Meet Adrena Roid's sister of Peggy No Floss. She has a hygiene appointment today. However, she is afraid of them. She is an outstanding student of Loma Linda University School of Dentistry. She enjoys long walks on campus, hanging out with her classmates. She loves boba drinks. Unfortunately, she is suffering from many things. She suffers from stage 1 hypertension. Symptoms include headaches, shortness of breath, nosebleeds, but these signs and symptoms aren't specific and usually don't occur until high blood pressure has reached a severe or life-threatening stage. She received a heart transplant a year ago. Unfortunately, the transplant heart developed valvulopathy. Symptoms include arrhythmia, pulmonary hypertension, cardiac shock, heart failure, death. She takes medications for the transplant, but unfortunately, she has developed secondary adrenal insufficiency from it. Symptoms include fatigue, lethargy, muscular weakness, headache, confusion, fever, nausea, vomiting, abdominal pain, hypertension, tachycardia, diaphoresis, dehydration, sunken eyes, dyspnea, dizziness, and adrenal crisis, which can lead to death.
Valvulopathy is a condition in which the heart valve becomes inflamed or stiff and is usually developed from heart transplants. It has been thought that dental procedures could cause ineffective endocarditis in patients with underlying risk factors and that antibiotic prophylaxis is effective in preventing it. There's published evidence that indicates that a small number of cases of ineffective endocarditis are caused by dental procedures, so therefore patients would benefit from antibiotic prophylaxis even if the antibiotics were 100% effective. Most cases of ineffective endocarditis are caused by oral microflora that are probably the result of random bacteremia from daily activities like brushing, flossing, and chewing. Therefore, more emphasis should be placed on improving oral health and access to dental care in patients with underlying cardiac conditions that are associated with the highest risk of adverse outcomes in those who have conditions that predispose them to ineffective endocarditis. So some other conditions that require antibiotic prophylaxis would include patients that have had prosthetic heart valve, previous history of ineffective endocarditis, damaged heart valves, a transplanted heart, and congenital heart disease. So since our patient has had heart transplant with valvulopathy, an antibiotic with prophylaxis is required. Hydrocortisone is a glucocorticoid. Our patient is taking 20 milligrams a day in order to prevent her body from rejecting the new heart that has just been transplanted. However, a major side effect is that it is causing her secondary adrenal insufficiency. Even though this is happening, she needs to continue to take her steroid. Adrena is very fearful of being at the dentist, so her stress levels will rise when she is in the chair. However, because of this secondary adrenal insufficiency, there is not enough cortisol being made to deal with the stress of the appointment. This could cause an adrenal crisis. Therefore, an additional steroid may be given to take the place of the lack of cortisol. This may be confusing because the initial steroid is causing her insufficiency, but nevertheless, it is needed for Adrena to safely get through the appointment without an adrenal crisis. Because of the second steroid for her fear, a med consult would be required. Adrena would not be treatable today because we would send her for a med consult. Once Adrena is safe for treatment, we would need to give her antibiotic prophylaxis, which would be 2 grams of amoxicillin because of her valvulopathy from her heart transplant. For her stage 1 hypertension, she would be taking propranolol of 80 milligrams orally once a day, along with over-the-counter aspirin of 81 milligrams a day.
Based on the patient's health history, we know that she is taking medication for hypertension. Stage 1 hypertension has a systolic of 140 to 159 and a diastolic of 90 to 99. Stage 2 has a systolic of 160 to 179 and a diastolic of 99 to 109. The primary risk factors involved are tobacco use, hereditary, overweight, race, excess salt, sex, age, and stress. Secondary risk factors include oral contraceptives, kidney disease, endocrine disorders, which are hyperthyroidism, diabetes, Cushing syndrome, and medications are NSAIDs, decongestants, and steroids. As a clinician, we need to know what modifications we should take into consideration, which would include stress reduction protocol, early appointments, short appointments, and cardiac dose.
So our patient has been diagnosed with secondary adrenal insufficiency, and we're going to see how that affects the body, but first we need to see how the body normally reacts. So first we start out in the hypothalamus, and that is going to stimulate the pituitary gland, but after making CRH, it's going to stimulate the pituitary, and that is going to make ACTH, which is then going to stimulate the adrenal gland to make cortisol, which then is sent out to relieve stress, just different stresses on the body. And when the levels of cortisol go up, it's going to cause the negative feedback reaction back up here to reduce the amount because we don't need as much now that these levels are up. But someone with secondary adrenal insufficiency, they're not secreting enough ACTH. So typically they're going to be given a glucocorticosteroid or any sort of steroid, and that is going to replace the cortisol that's not being made. So that's going to have an effect on these two, and it's going to suppress them because if we're giving the cortisol replacement, then we don't need the body to make any more, and it's not doing it anyway, which is why they need the medication. So if this isn't taken care of, either with a steroid or another form of treatment, it can cause adrenal crisis, and that's because of the severe lack of cortisol. And for our patient, if this were to happen, it would be because of her chronic adrenal insufficiency. It can lead to shock, cardiovascular collapse, and even death. And because of this, a med consult is not recommended, but it's required. So our patient would need a med consult because of this.
Cyanosis. I don't know how to say that. Cyanosis? Is that how you say it?
Cyanosis?
Cyanosis?
Yep.
Can we delete that? Okay.
But it's required, so our patient would need a med consult because of this.
Of adverse outcomes in those who have conditions that predispose them ineffective endocrine. Cut. Hydrocortisone. Okay, start over. Just cut it out. Ready, Freddy, go.